I'll give you a quick overview of why we're focusing on traffic safety culture and why we're focusing specifically how that impacts safety in rural areas. First of all, just to set the scene on a larger global sense, this is a figure from the World Health Organization and showing the percentages of all fatal injuries in the world, different causes of fatal injury in the world. And the largest leading single cause of fatal injury in the world is road traffic crashes. Not war, not drowning, not falls, not poisoning, nothing else. The main cause for fatal injury in the world is traffic crashes. So it's a huge international public health issue. It's not just a Montana issue or a U.S. issue. It's a huge international issue. And we should focus on it on an international level and try and leverage what other countries are doing to have an impact on our local situation. When we look at where the U.S. is in relation to other countries, depends what kind of metric you wish to use. Some people prefer to talk about risk in terms of exposure to miles traveled. That's on the left. Other people tend to talk about traffic safety as a risk to the individual per capita. I tend to prefer talking with this type of exposure measure because it's what they use for other public health issues like cancer or suicide. It's a per capita risk. It's a public health issue, so I prefer talking about this metric. Either way, when we look at the international ranking of where the U.S. stands, we're not doing terribly well compared to the other countries. But as you can see, we're not doing too well compared to our peers, so they're doing something different, or they have something different about those countries that we need to pay attention to. Recently, there's been a lot of noise about the large drops in fatalities here in the U.S. Over the last couple of years, we've had some large drops, and we're not sure quite why that is. I mean, it may be because of the economic downturn as well. We'd like to take some claim for our innovative traffic safety activities that are going on, but it does look promising. But it's not a uniform improvement in the U.S. This table here talks about what the decreases have been in rural versus urban areas. And we see that the total improvement or the total reduction in the rural areas is about 10% reduction in fatalities between 2005 and 2008, whereas in urban it's been almost 17%. So there are improvements in fatalities. We don't know why, but the improvement is less in rural than it is in urban. Beginning to suspect there's something different about rural versus urban. And that is promising news, but we shouldn't get too excited because if you look historically back to 1976, there's been lots of ebbs and flows in the reductions in fatalities. So it's promising that we have reductions in fatalities, but we don't know how stable that is. It could just be a cyclical activity. Coming back to the theme of rural versus urban, don't worry about what's down here. If you look at all the states, the fatal crash rate per vehicle mile traveled on the rural roads in those states versus the urban roads in those states, and we can discuss what we mean by a rural versus urban road. The fatality rate is always higher for all the states on the rural segments of the road networks. So there's something, again, unique about the rural roads, the rural areas that those roads are going through, and probably the rural residents who live and drive in those areas. So we need to understand what's going on in the ruralness of our transportation system to tackle the largest traffic safety risk. For those of you who are renting cars and driving through our fine state, I will just warn you that we are the most dangerous per mile state in the U.S. So buckle up, watch out for caribou, and don't pat the bison. To resolve, there are reasons why rural is has a higher fatality risk compared to urban. That has to do with how the roads are designed. They're designed differently than urban roads. They're less forgiving, they're more hazardous, more curves, steeper shoulders, more roadside obstacles that you can hit, fewer crash barriers in the median. We also have in rural areas fewer hospitals and longer distances for EMS to get to you and get you back to the hospital. But there's also something about the rural culture which possibly feeds into how people drive and take more risks and are more resistant to traffic safety policy. This just happens to be data from Minnesota when I used to work there, showing all the crashes between 98 and 2000 and attributing them to either a driver state cause, the person was drunk, tired, distracted, driver behavior, they were driving too fast, something about the environment, icy roads, something about the vehicle, tire blew out or whatever, the brakes failed. And you can see that by far and away, the largest percentage of fatal crash causes are attributed to the human factor, the driver. So it's important to try and investigate in trying to understand the higher rural fatal crash risk. What is it about the human factor, the culture around driver self? And in fact, when we start comparing different behaviors, different driver state and driver behaviors between rural and fatal crashes, you see some patterns. Here we have a number of factors identified: speeding, the person was driving too fast or speeding, had a fatal crash, was driving drunk, was not wearing a seatbelt, and different combinations of all that. We see across the board that there's a higher percentage of these crashes in rural areas than urban areas. So there's more risk-taking behavior evident in rural areas. Why is that? That's the crux of why we're here, to understand what is it about rural areas that lead to these more dangerous behaviors. Specifically, what is it about the rural culture which is leading people to decide to engage in these behaviors and accept these behaviors as normal, and to resist policies and interventions that would prohibit these. So why do rural people speed more? Why is it okay for rural people to drink and drive more? Why do they decide to do it? They don't speed by accident. They don't drink and drive by accident. They decide to do it. What's making them decide to do that? And why are they more reticent about allowing or accepting speeding policies, automatic speeding cameras? Why are they more resistant to that in rural areas than urban areas? Because that's what we found. We've done research asking people in rural versus urban communities what's the perceived utility of different types of safety intervention, enforcement-based interventions, education-based interventions, or engineering-based interventions, and how useful they think they are, defined as, do they think they're effective, and do they want them in their community? And across the board, rural communities are a little more resistant to having imposed safety interventions in their communities. Why is that? We need to understand why so we can more effectively develop and introduce these interventions. So we have the situation where we've made some progress in safety, and here we're talking about VMT again, fatality risk per VMT. The top line is Montana itself, and the bottom line is the U.S. in general. And I mentioned before that there have been improvements in terms of safety, but it's not equal in all jurisdictions. And as an example, Montana, we have this sort of flattening out effect, where in recent years we're not getting as large improvements in traffic safety by doing the same thing we've always done. So we've done all the usual stuff, and we're not getting much more out of our improvement in our transportation system. And one of the hypotheses and why we have this summit developed was that we think there's some kind of cultural, quote, block, where all the previous tools have done all they can do, but none of these are addressing culture. And the reason that we have this, still have a certain fatality rate is because the culture is happy with it, is content with it. It's still generating risk behaviors, and it's still rejecting safety interventions. And that's why we're not getting any more improvement, because of this cultural block. So the whole point of these series of summits that we're doing is to understand what this is, how we can remove it, or at least how we can make interventions that can get through it. So we're talking about culture. And one of the things that you quickly find one thing we found when we did the first summit, and indeed when we had the webinar recently, is a lot of people have different ideas of what culture is. So one of the first things we need to do as a safety community is to come up with what we mean by culture and have a standard definition of it. So we're talking the same language. And there's two types of culture, really. There's the culture that we're talking about here today, the small c culture, where it's the culture that sort of governs behavior in small informal groups that come together, versus the large C culture, which is traditionally based around heritage and race and religion. We're primarily talking about this culture here. And what do we mean by culture in general? When people talk about general broadly, they tend to talk about three different aspects of culture. One is the behaviors that represent the culture. They're the behaviors that are generated by the culture, such as things as the rituals, ceremonial behavior, the things that the culture propagates. We also have the artifacts, which are the tools and language and art. I'd also include policy and laws that govern the behaviors, the tools by which we use culture. And the third is what I call cognition here. It's the values, what's important to a society or a group, beliefs, what's the belief structure of the group, what are the expectations, what do they think is normal for the group, attitudes, how do they value or what are their perceptions of particular behaviors, and ultimately the decisions that they make based on those attitudes, expectations, beliefs, and values. It's this cognitive part that we're focusing on, I believe, in this summit. We need to understand the cognition behind culture, what people believe, what attitudes they have towards certain behaviors, what do they perceive to be the norm for their group. We need to understand that cognitive part in order to change the behaviors that we want. Once we come up with a definition of what we mean by culture, we also need to come up with some kind of theoretical framework to explain how you go from changing culture to changing behavior. How does culture, the cognitive part of culture, affect behavior? It's not enough just to come up with a nice definition of culture. You need to know how it works, how it impacts people's decision-making to change their behavior. Because it's the behavior you need to change. You need to understand the cultural process and decision-making. And there are a number of theories out there that one can use, but in essence, we're trying to figure out how cognition affects people's decision-making to take risk behaviors. And if you can change their behaviors, that group of people now have a new way of behaving, a new norm, which in turn reinforces the change in the culture. And you have a self-propagating cycle. That's the ultimate goal. But we need to understand this process. What is the culture, the cognitive culture of a particular subgroup that we're focusing on, and how does that culture affect their decisions to take risks? And then we can change the culture to change the behaviors, and then we sort of self-propagate that. So as just an example, comparing rural, we did some work where we looked at people's attitudes in rural versus urban areas about wearing seatbelts. Urban is blue, rural is red. And their attitude here is how dangerous they think it is not to wear your seatbelt. Where down here is being more dangerous. And you can see that the rural group have different attitudes about the consequences of not wearing seatbelts. It's less dangerous. Particularly rural pickup truck drivers, which is a subculture unto itself. And in fact, we find in the actual behavior of not wearing seatbelts is higher in rural areas, presumably because part of their culture or cognition is that it's not dangerous to not wear your seatbelt. So they decide not to wear their seatbelt. So one needs to change their cognition to change their decision-making process so they decide to wear their seatbelt. That's the ultimate goal. As an example, Jeff Linkenbach and his team, who will talk later, has done some kind of social engineering of culture, if you will, by changing people's expectations of what other Montanans do, what the norm actually is. Changing the perception that a lot of people who don't wear their seatbelts say they don't because no one else does. But if you actually measure what people really do, most people do wear their seatbelt. And when you communicate people the true norm, that people actually do wear their seatbelt, it changes their decision-making process and they start wearing their seatbelt more. So this whole cultural paradigm is different than other conventional traffic safety paradigms. A lot of the other traffic safety paradigms focus primarily on the behavior itself. They don't care how you got to the behavior. They don't care about the motivation or the impetus for the behavior. They just care about the behavior itself. So educational programs, for example, impart knowledge and skill to learn behaviors. Enforcement strategies penalize behaviors. And engineering approaches generally modify the driving environment to be more accommodating to behaviors. So, for example, if speeding is your behavior, you've got engineering devices and things that warn you that you're speeding or make the crash less severe if you're speeding, or make the vehicle easier to control while you're speeding. But in all these cases, you're treating the symptom, the speeding. You're not treating the cause of the speeding. So the reason that there's speeding is still there in the system. It's not being affected. Only the behavior is being tackled. And what the traffic safety culture paradigm does is different. We don't, with this process, we measure the behavior, and we're trying to change the behavior, but we're trying to understand why the behavior is occurring. What's the cultural basis for the behavior? And then come up with ways of transforming the culture so that speeding is no longer acceptable or perceived to be the norm, or changing the culture so that drinking and driving, which leads to speeding, is no longer acceptable or seen as normal. So we try and change the impetus, the reason for the behavior, not just react to the behavior. And the trick here is that we're transforming the culture, trying to transform the reasoning, the decision-making of the drivers, not just change the behavior. A couple of key aspects of doing that. The first is that we need to focus on changing the culture on multiple levels in our society. If we take an ecological perspective, we have the center of this ecological perspective, the individual, and that's the individual's decision-making we're trying to change. And we're trying to change it by changing the culture that influences that individual at multiple levels. Their immediate relationships, for example, with their family and their peers, within the community itself, the organizations they work in, and the larger society. One needs to identify the cultural influences at each of those multiple levels, because we're impacted culturally at a lot of levels as we go through life. So we need to tackle the problem not just focusing on individual decision-making, but that how the different levels of culture in the relationships in society affects that individual. Part of it, too, and I took this slide from Bernie Arsenault, is it's not just changing the culture that affects individuals, the drivers who are having the crashes, it's also changing the culture of the organizations responsible for traffic safety. That needs to be changed as well. Not just the drivers, but those people responsible for traffic safety. And this is an example from Towards Zero Death in Minnesota, where a number of agencies that are responsible for different aspects of traffic safety came together, which itself is novel, and formed an umbrella committee and high-level umbrella goal towards zero death in Minnesota. And it changed their culture by working together, no longer in silos, working synergistically, all pointing toward the same goal. We need to have that level of change too, not just the culture that affects the individual drivers.